Tonight, Dr. Anthony Fauci says the full-blown pandemic phase of the coronavirus is nearly over in the U.S. However, with that said, cases and deaths continue across South Carolina. Today, DHEC reported 32 additional virus-related deaths, giving South Carolina more than 16,000 deaths since the pandemic started. DHEC says that number would have been much higher if there were not life-saving vaccines available to the public.
Vaccines don't just protect you. They protect the people around you, your family, and the people in your community. You can't always tell by appearance that someone has a health issue that makes them more susceptible to the virus. That is, if they get COVID, they aren't as lucky as you and may not just have a few mild symptoms. The virus knows how to overcome people with weakened immune systems. And though these susceptible individuals have done their part to get fully vaccinated and get their third doses and get their booster doses as recommended, because the virus remains so prevalent in our communities, it's continuing to hurt and kill people who have done all they could to try to protect themselves.
DHEC's most recent analysis shows that between December 16th and January 15th, 64% of COVID deaths were patients who were not fully vaccinated. DHEC also confirmed today that 2 cases of the new Omicron subvariant have been diagnosed in the state. The health agency says preliminary studies show that this subvariant may be more easily transmitted than the original Omicron variant. However, it seems to respond the same to vaccines and does not appear to cause more severe illness.
Meanwhile, DHEC is reporting just over 3,100 new cases across the state. The percent positive rate remains at more than 30%. And despite those cases declining now, doctors at Prisma Health say more people are experiencing a mental health crisis, especially kids. Prisma Health says isolation and quarantines related to the virus cause many children to experience anxiety, depression, and low self-esteem.
Oftentimes when kids don't feel good about themselves, they have a hard time recognizing that others might see them as a value as well. And so the way that might manifest is that kids who are suffering from a mental health problem like depression, they may be more inclined to perceive other people as thinking negatively about them or treating them in a negative manner.
Well, doctors say parents should take advantage of mental health resources. Oftentimes, your child's primary care provider can refer you to an adolescent psychologist.